Và xin chào tất cả các bạn. Hiện nay, hóa xạ trị là điều trị tiêu chuẩn trong thư cổ tử cung giai đoạn tiến xa tại chỗ. Nó giúp cải thiện sống còn toàn bộ cũng như sống còn không bệnh tiến triển. Tuy nhiên, với mục đích cải thiện hơn nữa thì các bác sĩ Nhật Bản đã thực hiện một nghiên cứu về hóa trị duy trì sau khi hóa xạ ở những bệnh nhân này. Và nghiên cứu đã thu nạp được 351 bệnh nhân với thời gian nghiên cứu lên đến 8 năm từ năm 2010 đến năm 2018. Và tại hội nghị ESMO năm 2022, bác sĩ Keiichi Yuwara đã đại diện nhóm nghiên cứu trình bày về kết quả của nghiên cứu này. Xin mời các bạn cùng lắng nghe.
It's my great honor to be a speaker of this great meeting, and on behalf of all the investigators and the study team, I really thank the Congress organizers. So I'm presenting the result of a randomized phase 3 trial of a maintenance chemotherapy with a Tigafil uracil, which is UFD, versus observation following concurrent chemotherapy for locally advanced the cervical cancer. GOTIC-002 LUFT trial. By the way, the LUFT stands for long UFD. Here's my the COI. So for the background, as you know, the standard therapy for locally advanced cervical cancer is concurrent administration of the chemotherapy with the radiation, CCRT. Although it improved outcome of the locally advanced cervix cancer compared with the radiotherapy alone, there is a lot of room to improve survival. So one approach may be a maintenance chemotherapy for after the CCRT, and the UFD has enhanced the anti-tumor effect by combining a Tigafil, which is a progenitor of 5-FU, and uracil that inhibits the degradation of 5-FU, which is an active metabolite. And actually, UFD has been shown to improve survival of gastric, lung, colon, and breast cancer when it was used as a maintenance chemotherapy settings after the surgery for those the diseases. And also, in Japanese phase 2 trial showed the efficacy of UFD on the recurrent cervix cancer, and the subsequent analysis of phase 3 trial showed the survival benefit of adjuvant chemotherapy using oral fluoropyrimidine agents. So this is the UFD. So the combination of the uracil and Tigafil, and the Tigafil will be metabolized to the 5-FU, and other two metabolites is the GBL and GHB. So this is the rationale why we use the UFD. So GBL and GHB, which is the degradation product of the Tigafil, has the anti-angiogenic effect. So this is time-dependent, not dose-dependent, even at the low concentrations. And also it was observed high anti-angiogenic effect, which was provided when contacted with the tumor cells for a long time, and the anti-angiogenic effect was enhanced when they were administered continuously. So we decided to use the UFD of the dosing at the 300 milligram per day for patients less than 1.25 meters squared, and 400 milligram per day for the patients larger than equal 1.25 meters squared, and no interruption for 2 years based on the metronomic chemotherapy theory. So the object of our study is to prove the superiority of oral administration of low-dose UFD for 2 years as a maintenance chemotherapy after the curative chemoradiation for the locally advanced cervix cancer, comparing with the standard care, which is observation alone. The study design is very straightforward. Cervix cancer stage 1B2, which is an older staging system, and 4A, patients received chemoradiation and achieved PR or CR after the chemoradiation was randomized either to the arm O, which is observation, or arm UFT, giving the UFT for 2 years. The stratification factors included the stages 1B2 and 2 versus 3 and 4A. Primary endpoint was PFS, and secondary endpoints included OS and quality of life and cost benefit. Key eligibilities is listed here, and I emphasize that we only included the squamous, adeno, and adenosquamous cell carcinoma, and the other criteria are pretty standard. We excluded the patients who received the surgery after the chemoradiation or before the chemoradiation. And also we excluded the patients who received the neoadjuvant chemotherapy before chemoradiation therapy. So this is the statistical consideration, which is very standard, and the target accrual was 350 patients, and target events for the PFS was 196. And assumed the PFS rate at the 3-year for the observation was 60%, and hazard ratio set the 0.7. So this is the enrollment status. The study started in June 2010 and completed in 2018. It took a long time. We have enrolled 351 patients and randomized to 178 patients for the arm O and 173 patients for the arm UFT. And we did not have the patients who was excluded, but we have the 7 patients excluded for the safety analysis. 2 patients was withdraw the consent form from the arm O, and arm UFT treatment has never done in those 5 patients. So patients' characteristics were well balanced between 2 groups, and mainly we had the 2B or 3B patients, and almost 90% of the patients were squamous cell carcinoma. And almost of all patients were this PS of 0, and cisplatin was used for the chemoradiation. And those patients were responded to the chemoradiation therapy. Here's the survival outcome. Unfortunately, there is no differences between progression-free survivals or overall survivals. And also, we try to look at the subgroup analysis to find some groups which benefit the use of the UFT, but it was not. And the adverse events of the interest is listed here. So as you can expect, the odds ratio of the adverse events of arm UFT and arm O was 5.05, significantly more than the observation alone. However, when we look at these severe adverse events, there was no differences between two arms. So again, apologize for this busy slide, but as you can see, the serious the adverse events of the interest is only the vascular disorders, which was observed in a 2.4% in the UFT arm. And treatment emergent SAE is listed here. It is reported by the investigators that it is related to the UFT, but it looks like the 2 of them were related to the long-term effect of the radiation therapy. And again, the vascular events are of concern of the UFT. And dosing of UFT was modified in 14.3%, and the dose interruption was required in 36.3%. So in conclusion, oral continuous administration of low-dose UFT for 2 years was well tolerated after the curative chemoradiation therapy for the locally advanced cervix cancer. However, neither of PFS nor OS were improved. Based on the results of other trials, such as Outback study, maintenance therapy for locally advanced cervix cancer must be strategized not with the cytotoxic chemotherapy, but with other modalities. I'd like to thank all the patients and families and all the study coordinators and the data managers and the central facility, and also investigators and the research associates of the Luft trial centers. Thank you for your attention.
Vâng, bài trình bày đến đây đã kết thúc. Cảm ơn các bạn đã chú ý lắng nghe. Nhớ like, share và subscribe để theo dõi kênh của mình. Xin chào và hẹn gặp lại.